Okay, now we're going to talk about a handheld neuromuscular electrical stimulation unit. So this one is our Intellect NMEX. And so this is a unit you would want to use for your patient as a home unit if it was working well and you wanted them to be doing this at home. So there's a couple of things you need to know just for safety purposes for both doing it yourself and for teaching your patient for home, so they don't harm themselves or burn themselves. So first of all, you go in the back. That's where the battery goes, and these are 9-volt batteries. And so you got the positive and the negative. So I'm going to just stick that guy in there, like so. Okay. And then up top here is the intensity of, and you just need it to click in order to turn the unit on. So no electricity is coming out of this. You again have 2 channels. You can open it up right here. This can either be channel 1 or channel 2. So since we turned this one on, this is where I'm going to put my plug in. Okay. And the nice thing about this is that once you set it for a patient, if you're not sure that you don't want them to mess with those dials, you can close this up, and that's kind of a little nice safety feature. Okay, so in here we have your mode. We have the set button, which kind of enters it, and the up and down. So up top, you're going to see, it'll tell you channel 1, channel 2. Then right here it says synchronous. Synchronous means when the electrical current is going to be same on both channels at the same time, and you always want to add so this has to do with your on-off time. So if you're going to add a ramp time of 2 seconds, your on time has to be at least more than that 2 seconds on, that 2 seconds off. So it has to be more than that 4 seconds. So if I want them to actually get a 10-second contraction, I'm probably going to put that on time for 14 seconds. It also, you can see here is where the pulse width is, which is kind of nice on this one. Most of the handheld units have a fixed pulse duration or pulse width of somewhere between 250 and 300 microseconds. This one, you can change it. You can change the ramp time, you can change the pulse rate, and the on-off time, and then the timer. So we're going to just go through it here. So first the the ramp time, so we can go down to 1 or we can go to 2. So 2 is kind of normally where I set it. There's my on time, and because I had that ramp time, I'm going to make this for 14 seconds. Hit set to enter it. My off time is going to be about 50 seconds. So I could make that, if I wanted to be technical with my 1 to 5, if I was at 14 times 5 is 70, so that would be a long time off, but we'll just kind of, for demo's sake, do that and set that. The pulse rate, 50 is about right, anywhere between 35 and 80, and we know that somewhere between 45 and 50 is ideal for a comfort for the patient where they don't get burns, as long as we can get a good contraction. Generally, I'll make the pulse width bigger if I can't get it versus having to go up on the pulse rate. So we're going to go through that. We have everything checked. All looks good. So now we're going to go over to the time. We're going to go for 10 minutes. And we're set. And then we're going to go up here, and we're going to, this is the important one. So up here you can see you have alternate, synchronous, and constant. When we're setting this, we want to set it at constant, because remember you have that on-off time. If you're not going, if you were to try and set that in the other modes, it's not on for the whole time, so you could shock your patient. So you just want to really make sure that when you're turning it up to get that muscle contraction, that you have it at constant. And then once you get the contraction you want, then you can put it over to synchronous. Okay? And then you close it up, you set the timer, you give them a bell in case they need you. You come back in 5 minutes to double check on them, and you always let them know how to turn it off. Okay? And you want to make sure they know which direction to turn that off at. Alright, and that's it. Thanks.